Now let's move on to fetal hydrothorax, which is a condition characterized by the accumulation of fluid in the pleural space, which is the area surrounding the lungs within the chest. This fluid buildup can affect one or both sides of the fetal chest. There are several potential causes for fetal hydrothorax. It may result from a lymphatic malformation where there is improper development of the lymphatic system, leading to fluid leakage. It can also occur due to heart failure, where the heart is unable to efficiently pump blood, causing fluid to accumulate in the lungs. Chromosomal abnormalities, such as Turner syndrome, are also commonly associated with hydrothorax. Understanding the underlying causes is essential for determining the appropriate management and assessing the prognosis. Let's take a closer look at how 3D and 4D ultrasound are used to diagnose and monitor fetal hydrothorax. With 3D ultrasound, we can identify the presence of fluid collection within the pleural cavity, providing a detailed view of the chest anatomy, while 3D imaging offers a clearer visualization of chest structures. It is typically used as a complement to standard 2D imaging, of course, which means uh, that 2D remains the primary tool for diagnosis. 4D, on the other hand, allows us to assess the dynamics of the condition, where we can monitor the progression of fluid accumulation over time and observe any associated effects on fetal development. For example, it helps in visualizing any displacement of the lungs or heart, which can be crucial for understanding the severity and potential impact of the hydrothorax on fetal well-being. Now we have a special video prepared for you that will provide a deeper understanding of fetal hydrothorax. This video will give you an up-close look at how the condition presents on ultrasound, including key features to help with diagnosis. We encourage you to pay close attention to the images and explanations, as this will give you valuable insights that will support your learning. Please watch carefully, and we will discuss the key takeaways right after the video. Let's now review the key findings for fetal hydrothorax in ultrasound. The primary feature of fetal hydrothorax is the presence of fluid in the pleural space. On ultrasound, this fluid typically appears as an echoic dark area, which helps us to distinguish it from other structures in the chest cavity. Hydrothorax can involve one side of the chest, unilateral hydrothorax, or both sides, which is called bilateral hydrothorax. Bilateral involvement can tend to be more concerning and may be associated with more severe outcomes due to the increased fluid accumulation. As the fluid accumulates, it can cause displacement of the thoracic structures. This means that the lungs and heart may be pushed of their normal position to the opposite side, which can further impact fetal development and fetal well-being after birth. In some cases, hydrothorax can lead to hydrops fetalis, a condition where there is a widespread fluid accumulation in multiple areas of the fetus, such as the skin, abdomen, and around the heart. Hydrops fetalis is often a sign of a more severe presentation and can complicate the management of the condition. Let's take a look at the associated conditions, management and prognosis for fetal hydrothorax. Fetal hydrothorax is often linked with chromosomal abnormalities, including Turner syndrome and trisomy 21. Additionally, hydrothorax can be associated with choreotic or lymphatic abnormalities, intrauterine infections, or maternal conditions, all of which may influence the severity and outcome of the condition. When it comes to management, the approach depends on several factors: the underlying cause of hydrothorax, the size of the effusion, any associated complications if available. In more severe cases, drainage procedure may be considered to relieve pressure and improve fetal well-being. The prognosis for fetal hydrothorax can vary significantly if the condition is non-progressive and is associated with only minor abnormalities. The prognosis can be relatively good, with many babies able to do well after birth with proper care. However, if Hydrops fetalis is present or if the condition is severe and progressive, the prognosis may be more guarded. And careful monitoring and intervention are crucial for the best possible outcome.